Everyone, wherever time or whenever time you're actually viewing this PowerPoint presentation. I want to start out by first saying thank you so much for taking into consideration to viewing my PowerPoint with Miss Lakendra. The topic that we are deciding to discuss is women's health. And the topic that we are specifically are going to discuss in this PowerPoint presentation is the postpartum readmission after hypertensive disorder related to pregnancy. Myself and Miss Lakendra Starks, we came up with this great idea because we both are doing our practicum in mother baby, which is women's health, and we have noticed a significant increase in the number of readmissions of mothers who have had hypertensive disorders such as preeclampsia, gestational hypertension, or chronic hypertension. So in this PowerPoint, we are going to explain to you about the issues that are going on with this topic, the signs and symptoms, the general population that it affects, and some of the outcomes or plans and goals that we hope to use to address this issue. All right, so the patient population that is affected by the postpartum readmission after the hypertensive disorder during pregnancy is women who have been diagnosed with gestational hypertension, preeclampsia, or it progressed to preeclampsia during the pregnancy. And this specifically has been targeting a lot of African American women, although it can affect women of any race regardless of them being diagnosed with these certain conditions. But in overall, studies have shown that it has specifically affected black women. So, according to the Preeclampsia Foundation, 86% of women who do not receive treatment or a prescription for an antihypertensive medication following discharge were readmitted back into the hospital within a week of being discharged. Black women are 60% more likely to develop preeclampsia and 3 times more likely to suffer a death from complications of preeclampsia, according to the Preeclampsia.org. And when it comes to preeclampsia, this is a medical emergency. When I say medical emergency is that this is a priority because preeclampsia is so severe that it can progress to severe eclampsia where the client can have seizures, they can have a coma, which can later on progress to death. So just learning from the Preeclampsia Foundation that 86% of women who did not receive a prescription for an antihypertensive medication following discharge were readmitted, that is concerning because it lets us know that future outcomes and positive outcomes to promote patient safety in the future could be resolved by us collaborating with other members of the healthcare team, such as the physician, to ensure that moms are being sent home with antihypertensive medications to ensure that they are managing their blood pressures adequately and effectively. Okay, so although I have kind of briefly went over a couple of examples of hypertensive disorders during pregnancy, I do want to point out and further explain those hypertensive disorders of pregnancy in further details. So the first one we have is preeclampsia. Preeclampsia is a hypertensive disorder that usually develops after 20 weeks of pregnancy, which can eventually lead to eclampsia, where the mom will experience signs and symptoms of seizures or death if the issue is unresolved. Then we have gestational hypertension. So this is where the mom developed hypertension during her pregnancy after 20 weeks of being pregnant. And then we have chronic hypertension. So, chronic hypertension is where the patient had a previous diagnosis of history of hypertension before they even conceived. And the pictures in the background, I just kind of put up some signs and symptoms that we could be aware of when it comes to preeclampsia, and this is across the border with any hypertensive disorder during pregnancy. And later on in this PowerPoint presentation, we will go over some of the signs and symptoms as well. All right, so now we're going to talk about the signs and symptoms that moms with preeclampsia may present with whenever they go for a follow up visit or if they're inpatient and things like that. So, some of the signs and symptoms can include blurry vision, a severe headache, a blood pressure reading that is greater than or equal to 140/90 consistently for 2 or more weeks. They have nausea and vomiting. They may have some signs and symptoms of seizures, changes in mental status, or they may present with swelling or facial edema and things like that. But the number one key sign that I really want to point out when it comes to encountering mothers who have preeclampsia or symptoms of them, it's going to be that severe headache. That severe headache lets you know that something is severely going on with the patient's change in status. And I want you to think about it for a second. Preeclampsia is a form of hypertensive disorder during pregnancy, right? So think about going back to med surg and cardiac. Whenever you have too much fluid, too much pressure built in the vascular space, you're going to get these signs and symptoms of a severe headache. You're going to get these signs and symptoms of a blurred vision. You're going to get these signs and symptoms of changes in your mental status. You're going to get these signs and symptoms of nausea and vomiting. Why? Because you have so much fluid that is pushing up on the intravascular space. So think about it for a second. Whenever you're encountering these moms with preeclampsia, whenever they come present with these signs, it makes sense that they're going to have signs and symptoms of hypertensive, right? Okay, so now I'm going to discuss with you the risk factors for postpartum readmission. And when it comes to risk factors, we are going to talk about, which moms are at greater risk for being readmitted back into the facility after having hypertensive disorders of pregnancies. So the first one is the provider not prescribing antihypertensives to control blood pressures after discharge. And it makes sense simply because if the patient had preeclampsia or any other hypertensive disorder during pregnancy and their blood pressures weren't managed while they were in the hospital and they go home, it makes sense that if they don't have any antihypertensive medications to manage the blood pressures, then they're going to be at risk for coming back into the hospital and being readmitted again. The second one is preterm delivery. It makes sense because preterm deliveries, moms and fetuses and newborns, they're at risk for so many more complications. Large births, so if the baby was large for their gestational age, if mom had multiple gestations, meaning that she was pregnant more than one time, if the mother had unstable blood pressures while hospitalized, uncontrolled chronic hypertension, African American women, non-adherence to prescribed medications. And I want to point out with this one that it also goes to my other risk factor with the social determinants of health. So sometimes patients aren't compliant just voluntary. Sometimes they have barriers such as financial issues, environmental barriers, or they don't have enough resources to be able to be adherent to the prescribed regimen. Obesity is a risk factor. They have pre-existing health conditions such as diabetes and lupus, or they have an advanced maternal age. All right, so what are the negative effects of leaving this issue unresolved? So, the negative effects of relieving this issue unresolved includes that preeclampsia can progress to eclampsia features where the client will have a severe headache, they will have blurry vision, severe nausea and vomiting, decreased deep tender reflexes, proteinuria, and seizures that can lead to brain bleeds. It can also lead to death in most cases. The client can develop seizures, which can later on progress to a coma. They can have injury to other organs such as the eyes, lungs, the kidneys, the heart, and they can have future cardiac diseases such as heart failure and valvular disease. Okay, so three goals that we came up with that we think can help to resolve this issue is the first one, providing direct care to mothers for the first 48 hours after delivery. This one is extremely important because early detection is key during that postpartum phase after that mom gives delivery to the newborn. So, providing direct care to mothers for the first 48 hours after delivery is a great way that we can take to resolve this issue. This helps us to closely monitor moms for any complications of worsening signs of these hypertensive disorders. The second one is that we can collaborate with interdisciplinary members of the healthcare team, such as the physician or case management, to address if the client has any social determinants of health that prevents them from complying with the regimen. We can also do education, strict education through discharge teaching and admission to watch for signs and symptoms of hypertension, strict enforcement, reinforcement to take medications as prescribed, and check blood pressures daily at home and keep a log of them. The last one involves ensuring timely follow up appointments with the healthcare provider to monitor for potential complications and address any concerns early on. All right, so I'm now going to discuss with you the first goal, which is providing direct care to mothers 48 hours after delivery. So, the first goal that we plan to carry out is to provide direct patient care to mothers for the first 48 hours after delivery of their newborn. Implementing this goal will help us as nurses to recognize and monitor for serious complications that can occur in mothers who are diagnosed with hypertensive disorders during pregnancy. Early detection is key to preventing the readmission of mothers back into the hospital. So, some of the interventions that we came up with include monitor the mother's blood pressures continuously or every 15 minutes until stable. Typically, if in the hospital, if the blood pressure is unstable, then we will follow the protocols to administer medications such as magnesium sulfate and antihypertensive medications as ordered. We can also implement seizure precautions because mothers who are diagnosed with hypertensive disorders while pregnant, they're at risk for seizures. So by doing this, implementing seizure precautions is very important to ensure patient safety because mothers with these disorders are at risk for seizures. So seizure precautions include padding the side rails, ensuring oxygen and suction equipment is set up and ready for use, having the bed locked in the lowest position, and providing the patient with a gown to ensure no restrictive clothing if a seizure were to occur. The last one is monitor the patient for worsening or new signs and symptoms that indicate that their health is deteriorating. And I also want to touch back on bases about the protocol that we typically do in the postpartum unit. So whenever a mom is diagnosed with any type of hypertensive disorder, whether it is preeclampsia, chronic, or gestational hypertension, the main protocol that we use in mother baby is the administration of magnesium sulfate. Magnesium sulfate can be used as tocolytic therapy during labor and delivery, which can help to stop contractions or to reduce birth. But we typically give it because magnesium sulfate mellows the heart, it mellows the muscles, and in return, it also helps to lower the blood pressure. Now, magnesium sulfate is a great medication that we can use to treat hypertensive disorders while pregnancy, but it also comes with a lot of serious adverse effects. So as nurses, we have to monitor the mom continuously for MAG toxicity, which includes a decrease in deep tendon reflexes. They have seizures. The respirations are below 12. So in the case that magnesium sulfate toxicity were to happen, we would immediately stop the drug, and we would give calcium gluconate, which is a reversal agent, and we would notify the provider immediately. All right, so in addition to the previous slide where I talked about the first goal, we do have some short and long term goals that we plan to implement into our care plans when providing that postpartum care the first 48 hours initially after birth. So, some of the short term goals that we thought of that were great for our patient would be that the patient blood pressure will remain within normal limits within 12 hours of postpartum. And we want that because the more time that the blood pressure readings are remaining stable, the better outcomes that the patient has when they're getting ready for discharge. And then a long term goal would be that the patient will remain asymptomatic of worsening signs and symptoms of hypertension within 48 hours of postpartum and after discharge from the hospital. And I also like these goals because they are measurable, attainable, they're specific, including the time frame that we want our patients to have better outcomes. So, some of the benefits for providing care to the postpartum moms within the first 48 hours includes these interventions will benefit the patient population by promoting patient safety and better outcomes, which in returns will reduce the need for the mom being readmitted back into the hospital. And these interventions will also benefit the nursing profession by providing education on the protocols to take when caring for mothers who have hypertensive disorders during pregnancy. All right, now we're going to talk about the second goal that we came up with to address this issue, which is through education. Now, anything in nursing across the border, education is strictly important to ensure patient safety and better outcomes. So, strict education plays a key role in preventing the readmission of mothers back into the hospital after being discharged. These interventions include the following listed below. So we can educate the patients to follow up with their OB for their postpartum visits to identify and target early complications. We can educate the patients to regularly keep a record of their blood pressure readings at home. We can also do this by encouraging the mothers to keep a diary log of their blood pressure readings and the signs and symptoms that they experience. Now, demonstration may be needed on the use of a blood pressure machine, but we can also do that by demonstrating to the patient how to check their blood pressures and how to keep a regularly log. We can strictly enforce medication adherence as prescribed to ensure their blood pressures are being treated effectively. We can advise the patient to monitor for signs and symptoms of worsening preeclampsia or other hypertensive disorders after discharge, as patients sometimes will realize that they are not experiencing complication. And this is across the border with women when it comes to any type of cardiac problems like this. Women don't even realize that they're having a complication until they actually come into the hospital and the physician or the nurse detects it. Postpartum preeclampsia can develop within 48 hours after childbirth or 6 weeks later after childbirth, according to the Mayo Clinic. We can advise the patient to contact their provider immediately if these symptoms arise, and these symptoms include nausea, vomiting, a severe headache, shortness of breath, swelling, decreased urination, or blurry vision. All right, so in addition to that second goal, which was education to resolve this issue, we have some short and long term goals that we plan to implement into our nursing care plan. So, with education, a short term goal will be the patient will voice understanding within 12 hours that they will attend their postpartum visit with their provider. They will present the provider with their diary of blood pressure readings and the symptoms that they have experienced since childbirth. And a long term goal would be medication adherence, so the patient will follow the provider's medication regimen and report any adverse reactions within 12, 36, or 48 hours after discharge. Okay, so now we're going to talk about how education will benefit the patient population and the nursing profession. So, education will benefit the patient population because knowledge is power. An empowered patient who has been informed on the health risks of preeclampsia can share their knowledge. Through this effort, we can build a population of being proactive instead of reactive to risk factors, and it can also benefit the patient population because strict education, strict demonstration, and reinforcement of education can also lead to better patient outcomes and reduce the risk for the mom returning back into the hospital for a readmission. This will also help to benefit the nursing profession because nurses will be better advocates for their patients. Nurses will encourage their patient to report the symptoms and not dismiss their concerns during pregnancy. All right, now we're going to get on to our third goal, which is going to be collaboration. So, in nursing, sometimes our patients are not compliant with the regimen, not because they don't want to, but sometimes they can't. So, do you ever sit back and think of, if your patient has financial issues or environmental barriers that prevents them from being compliant with the regimen, right? So, when it comes to collaboration, preeclampsia is the leading cause of maternal death worldwide, and early detection in pregnancy can improve the outcome significantly. Participating in preconception planning with a specialist or genetic counselor will prepare the mother and their partner of any risks of genetic concerns that they could possibly face within their pregnancy pertaining to hypertension. So, when it comes to collaboration, we can collaborate with case management. We can collaborate with the physician to ensure that the patient goes home on antihypertensive medications to better control their preeclampsia, or we can collaborate with case management to help them with financial resources or environmental resources, so whenever they're discharged, they'll have these things in place. So a short-term goal would be that the patient will participate in preconception planning, prenatal care, and voice understanding of preeclampsia risk factors, as well as family history of hypertension within 12 hours. A long-term goal will be the patient will attend prenatal visits with an OB and specialist and adhere to prescribed treatment. This will benefit the patient population by empowering women to support the system through education and awareness of preeclampsia, and this will benefit the nursing profession by advocating for patients who suffer from preeclampsia. Nurses will have gained experience of carrying the patient's displaying signs and symptoms. Alright, so in this slide, we're going to talk about the barriers that will prevent the success of the plan. So here I have a model of the social determinants of health, and if you go back and recall to fundamentals, we briefly went over the social determinants of health, which are determinants that prevent patients from being compliant, or barriers that prevent patients from being compliant with their regimen. So the two barriers that will prevent the success of the plan includes the following listed below. One, social determinants of health. So if the client has financial issues, environmental barriers, or they live in a rural area that prevents them from being compliant with the regimen, this can be a key factor in preventing the plan to be successful. It is important that nurses assess the patient to determine if they have any barriers that prevent them from complying with the regimen prescribed. Some patients have financial issues, insurance issues, or physical limitations that leads to poor health outcomes, thus leading to postpartum readmission after discharge. To address this issue, we can collaborate with other members of the healthcare team, such as case management, to ensure that the patient receives the proper resources and guidance in complying with the regimen before and after discharge. The second barrier would be voluntary noncompliance with the medication regimen. So sometimes maybe patients just don't want to comply with them, and they have that autonomy to do so. But as a nurse, you also have the right to inform the patient about the risk factors that can happen if they don't comply with the regimen. So some patients have physical barriers that prevents them from complying. While others have voluntary or they voluntarily choose not to comply with the regimen. And to address this issue, we can enforce strict patient education about the importance of taking prescribed medication, the importance of monitoring blood pressures frequently, and the importance of following up with visits with their providers to ensure the best patient outcomes. All right, now we're going to shift our gears into talking about preeclampsia in Black women, because if you recall back to the um, the beginning of this PowerPoint, I specifically said that the postpartum readmission typically affects the Black women who are diagnosed with preeclampsia or other hypertensive disorders while pregnant. So, according to the preeclampsia.org, Black women are 60% more likely to develop preeclampsia and 3 times more likely to die from complications. And that's a risk factor across the border for anything dealing with cardiac. African American people, specifically women, we are at risk for majority of these cardiac complications, which can result in us dying, because sometimes when our Black women are going to these prenatal visits, they are telling the providers their signs and symptoms. We tend to get overlooked a lot, and that's not okay in our population, because we are at greater risk for dying if this disorder is untreated. So, how can we change this? We can establish community health centers, attract quality health providers, and offering student loan repayment scholarships. We can partner with community based groups, commissioners, and other leaders to expand awareness and provide resources. And we can overcome geographical barriers by expanding telehealth appointments to connect with patients and providers remotely. Okay, so on this slide, these are just some preeclampsia and eclampsia resources that if any of you would like to check out to get a further depth in detail about preeclampsia and eclampsia or any other gestational hypertensive disorders during pregnancy. So if you take a moment to pause this presentation, you can um, screenshot it, take a picture of it, and just, check out these websites. I think these are both great websites that'll help you and any other people who that are experiencing preeclampsia or eclampsia to know that they're not alone in this disorder, or they're not the only one dealing with it. So these are great resources that you all can check out. Alrighty, so I hope you all have enjoyed the PowerPoint presentation that Miss Lakendra and I prepared. I enjoyed doing this, guys, as much as you all probably enjoyed listening to me and going through this PowerPoint slide with me, because this is an issue that I really, really, really want to address someday, because it breaks my heart seeing mothers having to go through these diseases and disorders, and knowing that there's something out there that we can do to prevent it or stop it amazes me each and every day. So we are now down to our last PowerPoint slide of this presentation. Thank you so much for bearing with me as I try to explain my issue that I came up with. So the conclusion is that the clinical issue that we have identified as a current problem in the healthcare setting is the postpartum readmission of mothers back into the hospital after being diagnosed with hypertensive disorders during pregnancy. This issue has been going on for several years, and if there isn't a resolution to this issue, then mothers are at an increased risk for developing serious complications such as seizures, comas, or even death. The solution that we have developed to address this clinical issue is to provide direct care to patients for the first 48 hours during the postpartum period to monitor for any worsening signs and symptoms. We can educate the patient strictly about the medication adherence and or lifestyle modifications, and collaborate with case management and workers to ensure that patients who have social determinants of health receive adequate resources before and at discharge to prevent postpartum readmission. In conclusion, these solutions will help benefit the patient by promoting patient safety while providing the highest quality of care. Thank you all so much for looking at this presentation and viewing it and listening to me. Thank you all so much. Have a blessed day.